Hi there, Dr. Bajor, Access Chiropractic and Wellness. This video is just to give you an update as to an injury that occurred about a month ago. Some of you know, some of you don't know, but here it is. So on February 20th, on my birthday, I took my kids out to a trampoline park. We were running around, fooling around. I jumped off a ledge onto a trampoline just as I had done before. I told my daughter, I said, "Hey Julia, watch this!" And I landed on the trampoline, my knees buckled, heard a horrible, I knew then and there that I had done some serious damage to my knee. And sure enough, I had torn the patellar tendon completely off, ruptured it on both knees. So your patella, which is your kneecap, is like this. Your tendon up here is a quadricep tendon that goes up into your thigh, and then below is your patellar tendon. And together they keep the kneecap straight. This tendon was sheared off completely. My kneecap popped up and kind of was stationed there. So I was admitted to Foothills Hospital. That was a Wednesday. Of course, there was a snowstorm that day, and so they had all the trauma from Southern Alberta in. So I was bumped Wednesday for surgery, bumped Thursday for surgery, and Friday afternoon I finally had surgery. They reattached the tendons, drilled 3 holes in each of the kneecaps, weaved the tendons in back and forth, cinched them there, and then shut me up with about 50 staples between the 2 knees. For the next week, I had to stay, I could be upright right away, weight-bearing. That night, I stood up with a walker and walked up and down the halls a few times, which was fantastic. But for the next 10 days, I wore what are called Zimmers, and they're basically these wraps around the entire leg with 7 Velcro straps to keep the leg entirely straight. Went in a few weeks ago to get the staples removed, to get the Zimmers off, and I got these what we call bionic flexion extension casts, which limit how much my knee can bend. So they started me off at 15 to 20 degrees. 2 weeks passed, I worked on some range of motion at home, did a whole lot of cold laser on the injury itself, on the seam of the cut as well as the swelling. And then just yesterday went back to see the surgeon. Surgeon checked on things, range of motion is improved, swelling is down, the scar is looking fantastic, it's months ahead. And he said that everything is looking really good. Increased the amount of flexion that I can bend my knee from 20 degrees to 40 degrees, which is fantastic because that's all I need to practice. And he said as long as I kept them at that for the next 3 weeks, that I could go back to practice and back to work. Because there's no risk of injury beyond that, because it's limited to how much you can bend. So I'm pleased to say that, not even a month after the injury, I'm cleared to go back to work. I'm going to go back on modified schedule and modified patient load, but as I get stronger, then we'll increase back to the usual. And then in just under 3 weeks, I go back to see the surgeon again, at which point in time, he said that as long as things are progressing well, I can probably take the braces off, which is unreal, even though I'll probably keep them on, especially at practice, until I get solid and comfortable with everything. But why did this happen? Nobody knows. In fact, they were asking me, if I use steroids or use steroids. I said, look at me. Does it look like I use steroids? Or asked if I was diabetic, because tears like this are common, but not across both. But this is a freak accident. Now, I'm always telling patients, you should keep up with your regular chiropractic visits, once every 2 weeks or 3 weeks to stay nice and healthy. It doesn't mean you'll ever land up in injury, but if you do, your bounce back is fast. So take a look at me, for an example. I get adjusted all the time. The one thing that they told me consistently across the board from the very beginning was, you're really healthy, you're young, flattering. You're healthy, you're young, you're active, you're physical, and you're strong. Your recovery is going to be fast. Barely 1 month in, I'm being told that I can go back to work as long as I follow these rules, is at least a month ahead of schedule of what I would have expected. So it's just phenomenal and amazing. So if there's any reason to stay healthy, keep up on eating healthy, exercise, regular chiropractic care, this is living proof right here and there. But hopefully you're having as good a day as I am. I'm looking forward to seeing you guys back in the clinic as soon as possible. But it was great talking to you. Dr. Paul Bajor, Access Chiropractic and Wellness. We'll talk to you soon.